All right, well, good afternoon, everyone. Thank you so much for joining us. Thank you so much for agreeing to be on our panel. For those of you that may not know me, I'm Terry Williams. I'm Associate Regional Director with Development. Typically, I oversee our SBDC Center for Government Contracting and our SBDC COVID Business Recovery Accelerator, which is what we're here to, I think someone might still have to go on mute, but which is what we're here to discuss in our town hall. In particular, I'd like to thank Commissioner Tommy Calvert for joining us, Councilwoman Shirley Gonzalez, Dr. Barbara Taylor, and of course, our small business owner, which is will give us, great pleasure in hearing from her concerns and how we can help move forward. Let me make sure I pronounce your last name correctly, Jennifer Nekolela. Oh, was I close enough? I apologize. But without any further ado, I know we have quite a few business owners on the town hall. Jaime Martinez is our senior project manager for the COVID SBDC COVID Business Recovery Accelerator. He has done a tremendous job getting us to where we are right now and putting on all these sessions and getting the team ready. So I'm going to go ahead and hand it over to Jaime. Thank you for letting me do that intro. Thanks again.
Thank you, Terry. Good afternoon, everybody. Again, as Terry mentioned, thank you for joining us at our second COVID Business Town Hall. I myself was very excited about today when we've been planning for this. And so as businesses are reopening in the city of San Antonio and Bexar County, we have brought together a very esteemed panel for you all today to discuss exactly how the city of San Antonio and Bexar County have reacted and planned for the safe reopening of your businesses as we have been progressing over last month and this month to continue on and start operating as close to normal as we possibly can. Let's see here, and I'd like to go ahead and get started with that. So just a quick disclaimer, so this training was brought to you by our Southwest Texas Border Region Small Business Development Center Network, just as a public service and outreach to you all, the small business community here in San Antonio and Bexar County. It's not, today we're not bringing any kind of financial advice or anything that has to do with legal or legal ramifications, but that's why we've assembled this team of professionals and experts to be able to discuss this particular topic of interest to everyone. So just a quick housekeeping. All the questions that you will probably have, there is a chat box that is a part of this particular platform. Please submit your questions there. One of my colleagues will review them and hold them over for the end of our presentation. We will be sending you a survey after this town hall because we are a federally funded program. It is vital important to us that you please fill it out and submit it back to us. Again, it is very, very important. Our next COVID Business Town Hall is in 2 weeks. We'll be holding these town halls every 2 weeks. It'll be June 23rd, and it will be with the topic of workforce development. So who are we? Just before we get into our esteemed panel, the UTSA COVID Business Recovery Accelerator, our mission is to help the small business community through the relief process, rebooting, recovery, and the resiliency part of getting back to normal. So after this COVID-19 pandemic, and that's what we follow and why we are here and why we have been set up as funding through the CARES Act. We do have a website that we do recommend that you visit us. And to be able to obtain information on the disaster loans and any other type of employer resources that you may need as a small to medium-sized business, for example, or maybe even rehiring people. We're not just located here in San Antonio. We are the home office of the Southwest Texas Border Region, so there's 10 of us in total and the South Texas region. So we cover 79 counties. So we do have a large reach here in our area. We were set up, again, as through funding by the CARES Act, through the Small Business Administration, to be able to take on the capacity, additional capacity to the Small Business Development Center program that has been around with the University of Texas at San Antonio for about 40 years now. We are focusing on those COVID-affected small businesses with funding, which comes in the relief form, with the Paycheck Protection Program, the Economic Injury Disaster Loan. We have professionals to discuss any type of HR or related matters, human resource related matters within your business, cybersecurity, and workplace safety. So getting into our agenda and our esteemed panel, we will have starting up one of our clients, Jennifer Nicolella. She's with Abby's Attic Sewing and Craft Studios. Dr. Barbara Taylor, so the team leader of the city and the county's health transition team, and who's a physician there at the UT Health School of Public Health in San Antonio. So again, our counterpart here in the city. Commissioner Tommy Calvert, Precinct 4, thank you. Councilwoman Shirley Gonzalez, District 5. And our local expert, CJ Pettit, to discuss a little bit later on today in this particular presentation on workplace safety, best tips and practices. So I would like to get right in and introduce our esteemed panel. And so we have, again, Jennifer Nicolella, who I'm going to get into in a little bit more detail in just a moment. I have some information about her and a great success story about how she's benefited from the plan of the health transition team and the initiatives from the city and the county. But we do have as I mentioned, Commissioner Tommy Calvert. So Tommy Calvert was elected Bexar County Commissioner for Precinct 4 in 2014 and is one of the 5 chief executives of our county government. He continually runs unopposed, I see now, for the second 4-year term. And again, very importantly, he's also the youngest and first African-American county commissioner in the county. So, he's done quite a bit in his career. So I'll kind of cut through some of the important things that we've been fortunate for him to do for our county. So Commissioner Calvert saved Randolph Brooks Air Force Base from closure as chairman of the Randolph Joint Land Use Committee. He also has a background in international relations to create jobs for Bexar County. He has helped raise $44 million in foreign investment for foreign investors from such countries as Vietnam, China, Nigeria, Latin America, and other foreign countries around the world that want to invest in our community. Let's see here. One thing that I very much like that I read about Commissioner Calvert is that, let's see here. Oh, I lost my place, Commissioner Calvert. So yes, he is a hawk for fiscal responsibility and created the first tax exempt for seniors at the University Health System and is growing for exemptions to community up to $35,000 per homestead. He has cut Bexar County taxes for the past 3 of the 5 years that he's been in office. So again, welcome, sir, for joining us today. Next, we have Commissioner Councilwoman Shirley Gonzalez. She was born and raised here in San Antonio, Texas. Councilwoman Shirley Gonzalez is the daughter of Mexican immigrants. She has earned a bachelor's and a master's in business administration degrees from St. Mary's University. And her being a small business owner herself for more than 25 years here in San Antonio. As District 5 representative since 2013, she has used her experience as a businesswoman and mother of 3 young children in her work as an advocate for city budget and resource equity. She serves as the chair of the city's planning and land development, as well as the transportation and mobility committees. She also sits on the economic development and workforce, as well as governance committees. So again, thank you for being with us today, Councilwoman Gonzalez. Dr. Barbara Taylor is an associate professor of infectious diseases at the UT Health School of Public Health and the Columbia University College of Physicians and Surgeons. Dr. Taylor conducts impactful research to improve health outcomes for underserved populations living with at risk for HIV in San Antonio and internationally. She provides treatment for patients living with infectious diseases in San Antonio. A strong community advocate, she is also the co-founder of the South Texas Consortium for HIV and STI research here locally. So again, welcome. Jennifer Nicolella combined her passion for sewing and her experience as a STEM educator to found the Abby's Attic Sewing and Craft Studio, offering sewing lessons, camps, parties, and more. Jennifer helped sustain her business and workforce during the stay-home work safe order by making masks, taking in machine repairs, and other innovative efforts. And last but certainly not least, CJ Pettit is a certified professional in human resources with over 20 years of boots on the ground human resource experience. CJ has valuable and focused expertise in helping small businesses and safety programs and practices, and provides OSHA authorized training in general industry safety. So again, thank you. Welcome to all of you again for being with us today. So Jennifer, again, thank you for joining us on such short notice. And I know you do have to leave here momentarily because, well, you have your business to run. So, you and your team took the Greater Safer Together pledge. So Jennifer, can you talk about your experience with this valued initiative here in town?
Well, first of all, thank you for inviting me to be part of this panel. I really am super grateful to the city for how much they provided to us, small business owners. There were, I think, something like 5,000 or 6,000 kits that were passed out. Before this even started, before we were offered the COVID kit from the city, we sat together as a team and we were trying to figure out what would be the best course of action for sanitizing our equipment and keeping kiddos far apart, but yet keeping things fun and light. And so we realized that there was a shortage of hand sanitizer, and so the fact that the city was able to provide some for us was fantastic because it really solved a lot of our problems. Then just whoever planned that whole pickup process should be given a massive raise, because for them to be passing out 5,000 or 6,000 kits, I was in and out of there in 10 minutes. And it was so organized and everybody was friendly, and it was fantastic. I was really impressed at how the city was able to put something like that together so smoothly.
That's great. That's great news. So, again, as we'll get into with the panelists today, Jennifer, yes, I mean, a lot of this became as a result of the health plan, of the plan to open up the city and the county safely. So, again, we're happy to hear as a small business development center client that you were able to take advantage of this great initiative by the city.
Yeah, thank you. We really appreciate it.
Good deal. Thank you. So getting into why we assembled this panel today, everyone. So as many of you know, that on April 28th, the COVID-19 Health Transition Team appointed by Mayor Ron Nierenberg and County Judge Nelson Wolf released a multi-phase plan for reopening our community as safely as possible. This plan was presented to the City Council and County Commissioners. So starting off with you, Dr. Barbara Taylor, as really Commissioner Calvert and Councilman Gonzalez, could not really effectively do their job, again, without you and your team's, experience and expertise to be able to present this plan to them. So, we know this report is extensive and detailed in its direction for our city and county. You and your team went to great lengths to develop this plan. So the plan discusses indicators and capacity for the safe reopening our community. So Dr. Taylor, can you discuss some of those indicators most important to businesses and things they really should be considering at this time?
Yes, thank you so much, Jaime. I really appreciate the opportunity to be here and speak on behalf of the Health Transition Team. It is really an honor to live and work in a city and a county where the elected officials call on health professionals to ask for advice and guidance and to try to use the best public health data we can apply to our current situation. I also really want to recognize, though, our team worked, we were a team of 17, including liaisons with the city council and the county commissioner's office. We also worked in tandem with the economic transition team, which was led by business leaders. And so I would also call the attendees' attention to the economic transition team report, which came out and relied on some guidance from the health transition team, but also the state plan, which does have a lot of guidance for business. So I think my task is to try to unpack a little bit of the geeky background to the health transition team and provide a framework. My job is definitely not to tell people how to run their businesses. I'm not a business person. I work in a massive bureaucracy. I'm a small cog in that bureaucracy, and I'm happily there. I don't pretend to understand how to run a small business. So I'm happy to provide a little bit of a framework and answer questions, but would really rely on everyone else to provide that sort of information. So I think first, in terms of general principles of health and public health in the time of COVID, particularly as it would apply to small businesses, I think it's important for us all to recognize that there is no scenario in which there isn't risk. There is risk when we walk outside our door these days. Sometimes even risk come to us, depending on who you have in your house. But there aren't any ways to eliminate risk for COVID-19 until we have very effective treatment and a vaccine and no cases. So we all, as we enter the world, whether we're entering the world in a professional capacity or in a personal capacity, are accepting risk of transmission. So I think our jobs are to understand that risk and to know that risk and try to reduce that risk as much as possible. So for business, I think that means we have to figure out how to protect your employees. We have to figure out how to protect your community. And then we have to figure out what are the factors about your specific working environment. And sometimes people don't have an individual working environment. They have many different working environments that could be used to mitigate risk. So I think thinking about your employees, obviously a lot of the things that have been recommended already are potentially useful. So things like masks, frequent hand washing, staying distance from people, and things like allowing for sick leave, making sure that people know that if they feel unwell, they should not come to work, and trying as much as one can in the context of a small business to make sure that that doesn't have an economic impact on the individual. For the community, it's really the same principles. So one of the things that we did in the health transition plan was we leaned heavily on a report from the Bloomberg School of Public Health at Johns Hopkins, which looked at the factors that lead to risk in a specific setting. And there are really three factors. There is contact intensity. So that's in your specific setting, in your environment, how close are you going to be to other people? Do you have to be real close, or is it possible for you to stay 6 feet back? Is it possible for you to do things virtually? How many people are in your environment? So there's contact intensity, how close you are. There's then number of contacts. So how many people are there? Obviously, if you have 5 people, the chances of one of them having COVID is less than if you have 500 people. So in some ways it becomes a math problem. How close are you? How many people are you going to be close to? And then the final thing is how much you can change things. So I think there are many, many examples in business right now of people making changes to reduce risk. So mask wearing, all the shields that we're seeing. Like I went to the grocery store yesterday and there's plexiglass now up everywhere. There's signs reminding us to stay distant from one another. There's hand sanitizer at the door. So all of those things can reduce the risk in a place, but there are some settings where it's hard to mitigate risk. If you're getting your hair cut, you can't stand 6 feet away from someone unless there's a fancy laser that I don't know about yet. But it's hard to get your hair cut without coming into contact with someone. So there are scenarios, or my own work, where I see patients. I have to come into contact with my patients. And so what can I do to limit the risk to my patients of me, who is actually, I am a high risk group, I'm a health provider. So I think all of those things are important to think about. And you asked about the indicators. So I think the second piece of this is, as you think about framing risk mitigation in your work environment, how do you inform yourself about where San Antonio and Bexar County is in terms of the epidemic itself? So in the health transition team report, we proposed some indicators that will help us understand where we are as a community in terms of our response to the COVID-19 epidemic. And the city of San Antonio made a beautiful dashboard that has all the indicators on it. We're working, there's now a task force that is working and a working group that's working on making these indicators understandable, making them more easily readable. So that's in process. But I just wanted to quickly walk you through the things that I think are the most important in terms of looking at this and knowing where are we in our response to COVID, and do we need to be worried, or are we doing okay? So if you look at this dashboard, this is divided into progress indicators and warning indicators. And in the health transition team report, we said that progress indicators are things that indicate we're doing okay, we can move forward with reopening. And warning indicators are the things that indicate to us, well, you know, maybe we should do something different. Now, I should say, doing something different does not necessarily mean everybody goes back to stay safe, stay home, don't, you know, shelter in place. There may be things that we can do that are not that or short of that, including things like universal testing in congregate settings and nursing homes, which is something that the city and county are doing right now. But to go back to the dashboard, I think the primary indicator that many groups use, including the federal plan and now the state plan as well, is a decline in cases over the last 14 days. So when you're looking at, that's the graph that you can see sort of on the top left, I guess, yes. So this gives you sort of a running average of the last 14 days from date of reported symptom onset. So this is not necessarily when the test came in, it's when people are saying they fell ill. So you can see that over the last 14 days or the last couple of weeks, we've had sort of a steady decline in cases, then sort of a steady average, and then maybe another decline. So this is all decline. This is a decrease actually from April. If you are interested in data, you can actually dive deeper into this dashboard and pull all the data, and you can make your own graph of however long you want. So for those of you who are data geeks out there, there's lots of data there for you to use. So I think it's important to look at this graph because that tells us how many cases there are in our community. And if it's flat, and in particular, if it starts to go up, then that's a concern. However, it's important to take that into the context of that we're doing a lot more testing. There's more testing available in San Antonio than there ever has been before. These days, if you go into the hospital at University Hospital, you get a COVID test, regardless of whether you have symptoms. So we have a lot more testing. There's our mobile testing, there's walk-up testing sites, there's lots of places you can get testing. But so the number of tests is going up, and we are opening up. So we actually expect the number of positive cases to go up because we're doing more testing and we are having more risk. This is something that Dr. Emmerich talked about yesterday at the mayor and judges briefing. So the other indicator that I watch is actually on the other side of warning indicators, which is the percent of positive tests. So you can see, and that's demonstrated in two places in this dashboard. It's 4.5 for last week, and you can see like how it's been over the last, basically over the entire month of May in the bar graph along the bottom, the weekly positive tests. So why is percent positivity important? Because as the number of tests go up, that increases the overall number of tests. If the number of positive tests is also going up, that means that we are not just doing more testing, but it means that overall of the number of tests done, the number of cases is rising, which is a concern. So if you look at the last several weeks, you can see that we have been hovering pretty steady between 3.5% and 4.5% positivity. There is an increase of about 1% from the week before last to last week, which is something that we definitely want to look at, but it has been pretty flat. This, in the context of expanded testing, I think is a somewhat reassuring indicator. The other things that I want to mention just before I close on the dashboard are the systems things. So you'll notice that there's stuff on this dashboard about testing capacity, about contact tracing, about the health system stress score. So why are these things important? Really what we care about is how many people are infected with COVID. But the reality is that we know that when systems get overwhelmed, when we can't test everybody we need to test, or when we have someone who tests positive and we can't provide them with appropriate counseling and find out who else may be at risk around them or who else might be infected around them and get them testing, or when people are ill and they show up in the hospital and the hospitals aren't equipped to take care of them, if they don't have personal protective equipment or oxygen available or ICU beds, that is when the danger of a COVID epidemic to the health of our community starts to increase. So if we can't test everybody, if we can't help those people who are positive, protect those around them, and find other cases that are related to a single case, or when the hospital system can't respond to positive cases and provide outstanding care, then we're in trouble in our community and people will have a harder time. So if you look at this dashboard, there are several indicators of that. So for testing capacity, actually we have more testing, as I mentioned earlier, in San Antonio than we ever have. We have about 4,000 tests available a day. The number of tests actually done in San Antonio per day remains under 2,000. So we're still trying to make sure everybody's aware that testing is available and that you can get testing. The measurements of hospital capacity include things like the number of hospitalized patients. And you can see in the graph that that's been fairly steady since for the last few weeks. It is rising a little bit. Actually, as of today, it's 96. And so that's something we want to keep an eye out for. And that will be reflected in the health system stress score, which is a measure of, do we have enough hospital beds? Do we have enough health professionals, nurses and doctors, and personal protective equipment for those people, ICU beds, ventilators? All of that gets combined in a health system stress score. And it's, as you can probably see, sort of on the border between normal and moderately stressed, and has been for a while. So I think overall, looking at this dashboard, those are the things that I look at, and it means that we are in an okay place. I think time will tell over the next several weeks to months the impact that reopening has had on San Antonio and how we are doing that and how we're moving forward. And I would just remind everyone that we really have a unique opportunity to participate in the health of our community, because my health affects everyone around me's health. My health affects my father and mother's health, who I see on a regular basis. My health affects all of my patients' health. All of us have the opportunity to protect the people around us, particularly the folks who are most medically at risk or the most marginalized. We know that this epidemic has a disproportionate impact among people of color, particularly the African American community, followed by the Latinx community. And so I think we as San Antonians really need to make sure that we're looking out, not just for ourselves and our businesses, but for our whole community, and in particular, those who are most at risk.
Well, thank you, Dr. Taylor. I probably have learned more today on this particular dashboard than when I watched the mayor and the judge. And so thank you for explaining all the details. So that was great, very, very informative. So thank you. Commissioner Calvert, taking into consideration, I mean, obviously, again, as I mentioned about Dr. Taylor, her team went to great lengths to provide this information so that this dashboard could be created and you make decisions along with the councilwoman. So specifically for small businesses, We know that the Bexar County Small Business and Entrepreneurship Office has been extremely active, very, very active right now. So can you share with the audience some of those specific activities and initiatives that you all are a part of?
You bet. Thank you, Jaime, and thank you for all the panelists for their work over the last months on COVID. It's greatly appreciated, and glad to hear Jennifer and her business are on their way to doing a lot of good things with the mask and everything else. My first salvo with the small business department came by hearing a small business owner. I'm a small business owner 2 times over. I have an ad firm and a radio station here in San Antonio. And I know how it is to have to make the payroll. I know what it's like when you have to be the bookkeeper and the HR department, and you have to be the receptionist, the janitor, and do all those things by 12 o'clock as a small business person. And so I was talking to Andrew Aguiano from Southside Craft Soda, and we were just Facebooking, and he had this sense of urgency that really lit a fire in me to say, he's worried about making payroll. I get it. He is seen a collapse of the economy. There isn't any business coming in. Everybody is kind of at a standstill. So the county, we need to do something. So the very first initiative that we engaged in was thanks to him. And it is the Buy Local initiative. I think buying local is so critical, and having our own local supply of things is very important. So we've impressed upon that. Even in the procurement of the university health system, which the county oversees, or looking deeper into the county's procurement and purchasing, how can we get as many local products as possible from our vendors? The supply chain issues can be solved by that, and making sure that we have every sector of our economy feeding us or providing us and supplying us. So from that, we then moved to the program similar to what Jennifer described, which is the county gave away plastic separators, thermometers, masks, gloves, cleansers, sanitizer to small businesses. I actually personally went to about 200 small businesses. I didn't have them come to me, I came to them. And that was good intel and research for me. And I think it was a good thing, because at the time we did it just a few days ago, I know it seems like an eternity, all this time, they were just being allowed to open up. And when I got to the salons or got to the various places, I mean, they were like a day or two into opening up, and I realized, my goodness, they're just starting to make money. For them to have to come and go pick it up, it's a hardship, and it's maybe they're short hands, because the hands they used to have, they couldn't necessarily hire to come back. It's a lot of times the proprietor and a few others that are really trying to, just maintain what's going on. But I'm really proud of that. And to connect the dot on the local Buy Local initiative, we made sure that if you go to restock on the sanitizer or the gloves or whatever, we have a list of those local companies that you can restock from. So we know supplies are hard, these things are really hard to find. I can't remember who it was just said, oh, the Alamo College District just said they had a really hard time finding a lot of these items. And so we have local vendors. If you go to the Bexar County Small and Minority Veteran-Owned Business Department, where you can actually buy from the folks that we did. So very excited about that. Then fast forwarding to our grant program. I was concerned when the county first came out with a loan program from Lyft, not because I have anything against Lyft, but the loan program is very difficult for a lot of businesses to take on when they're not sure what the business is going to be. It's the forecasting, and this, I have an international relations and economics background, and I can tell you that economists have never seen the kinds of things that we're seeing, the kinds of curves we're seeing now. So I was really happy to fight. I led the court in changing it from a loan program to a grant program, and we reconstituted it. What is today? Today is Monday. Yes, yesterday. I'm working 7 days a week, 14 hours a day, every day. I don't know what day it is. I'm just going. But we reconstituted it where some businesses can get a $10,000 grant, other businesses can get a $25,000 grant. really local government is not really cut out to save us in a recession or depression. That is really an obligation of the federal government, but we do have some help and some support. But what I noticed is I had the GIS department map out where the loans were going. And I noticed that in the west, south, and east sides of town, they were not getting loans in the previous round, and they were not getting grants. And so I demanded that every precinct who has put in an equal amount of money to the $7 million that went out, every precinct should get an equal amount of grants. And so I'm really proud that our small businesses will be able to do that. And I'm fighting now to try and get groups like the West Side Development Corporation, San Antonio for Growth on the East Side, South Side First, the North Side Chamber of Commerce, to actually help our small business people fill out the PPP program from the federal government, because it's about $100 billion. And we see in the southern sector, below Hildebrand, if you will, we see 90% of businesses haven't applied for that federal money. 80% of businesses haven't applied for that money. And this represents about a $40 billion economic impact that we're leaving on the table. And in the next days, many businesses will go out of business if they're not helped. So I look to see more movement from the Commissioner's Court to help some of these regional nonprofits that are helping the local business economy get back on its feet, to help with those applications, because many business people, they may do construction particularly well, but the paperwork just ain't, that's just not their forte. Some things may not be together, so we're looking to have them help along with groups like UTSA Small Business Development Center. I'm so grateful to people like yourself, Jaime, and Terry Williams, your whole team, for what you're doing to uplift small businesses. Just wrote down a few notes. When we talk about opening safely, we do have to, we can't miss the forest for the trees. And the forest is, the federal government really has to get its act together on stemming the tide of COVID and getting a national plan. It is not constitutionally correct that all of this be left to state and local governments. I'm incredibly proud of the work that we're doing in spite of it all. But when it comes to testing, when it comes to things like using the Defense Production Act, there are a lot of businesses in San Antonio that could have been helped by that. And we still need to advocate for that. We still need to have our Congress people and our president push for those things, because we will likely face a real challenge come November when the cold months begin for a second wave. And if we don't have our ramped up healthcare, personal protective equipment, if we don't have some of the systems in better shape, this was just the appetizer potentially to the main course of the destruction of COVID-19. So, the governor has to get their act together with respect to contact tracing, with respect to local and state production of the things we need. We shouldn't have to go to Korea to get a test. We shouldn't have to go to China to get a test when we have Southwest Research Center right here and many other bioengineering companies. And we need to get the rainy day fund of the state. We need to get incentives from the federal, state, and local entities to produce economy for this healthcare fight. And there's certainly opportunity for businesses in the expansion of our hospital systems and the expansion of our testing and so many things. And I'm looking forward to seeing the innovation that comes out of this adversity. What has clearly become the greatest challenge of our generation, the loss of so many lives and the collapse of the economy is really, what we're here to talk about today. And this crisis has affected all of our lives. A lot of people have really lost, I'm sorry, of course the phone rings when I'm in the middle of a presentation. Sorry about that. Many of us have lost loved ones. I was just texting someone who I helped get transferred out of a nursing facility into a hospital. I believe their father had been, COVID positive for, over, 40 days, and was someone who walked 3 miles a day and now still can't walk. This is a particularly trying time and a burdensome time on so many families. And we think about the young people and how their economy, their unemployment rate is going to be affected, and how internship programs are not happening in small businesses. But we really need to think through how do we itemize the budgets of city and county governments and state governments and federal governments to keep young people engaged in the economy, to assist small businesses with the mentorship that exposes young people. And I think about what it would have meant for me, because I started working at 11 years old in a program from an organization called San Antonio Fighting Back, which was a substance abuse prevention and intervention program. I was paid $100 a month, but at 11, 12 years old, that was really good money. It was technically illegal, but we're past the statute of limitations. But we have to be renewed in our thinking about everything. And as small business owners, we are faced with adversity every single day that we have to adapt to. And this is, sad to say, probably the biggest. And I don't claim to have all the solutions, but I know that in listening, I've gotten a lot of great adversity knocked down, because you on the front lines of our economy have been incredibly adaptive. We in government haven't always been able to respond in the way that we want to, but these kinds of forums and town halls and initiatives like the Business Accelerator to help with COVID are really critical. So let's just keep the dialogue going, and thank you all for all you've done.
No, thank you. No, thank you. I mean, yes, you mentioned quite a few initiatives, excuse me, that the county is implemented and continue to work to be able to bring these businesses back and employees back safely in there. So thank you, Commissioner Calvert. Now, in moving to the city of San Antonio and their reaction and plan to COVID, Councilman Gonzalez, what are some of the key elements of the plan that the health transition team put together and helping to understand the impacts and requirements for businesses in reopening?
Okay, better. So, thank you so much for putting the panel together. Dr. Taylor does such a great job of articulating the information that they put together. And in that information, they put together a dashboard that helps clarify what are potentially high-risk activities, mild-risk activities, low-risk activities, rather than classifying businesses as essential or non-essential. Because as a small business owner, I think Jennifer can attest to this, that businesses are essential to us, for our families and for the people that we employ, whether or not they were deemed essential. And so I think by allowing the businesses to open slowly and allowing us the opportunity to serve our customers as safely as possible, giving the recommendations by the health report, and then the additional information that the city put out by taking the pledge. And it's a very simple pledge, and I think I'll read it because I have it here. I'm not sure that it's in your presentation.
Councilman Gonzalez, you cut out. Councilman Gonzalez, you're cutting out. We can't hear you. Councilwoman Rhee, I'm sorry, we can't hear you.
I think she lost audio.
Council, we can't hear you.
Let me message her.
Yeah, I'm sorry, we couldn't hear you. No, she said, okay. Looks like I'm sorry, we can't hear you. I guess what we'll go ahead and do is
I'm going to try and
Yes, Councilwoman. So we'll go ahead and do Councilwoman Gonzalez. We'll catch you back here in just a moment. But CJ, thank you again for joining us. So, CJ, you in consulting these businesses and, and really being on the front lines with them, boots on the ground, as you have mentioned, can you talk about hearing all those things, hearing Dr. Taylor's plan, the initiatives that Tommy Calvert, and the rest of the county commissioners have put together, and with these businesses safely reopening within San Antonio and the rest of the county, what can you discuss maybe your top 3 safety issues that you feel businesses should follow during this reopening process? And obviously every week and every month that goes by, the percentage continues to grow, the capacity continues to grow, for example, in restaurants. So talk to us a little about that.
Yes, thank you so much for having me. I love this panel. I admire and respect each one of you and your contributions and appreciate you for that. So I'm glad that y'all put this together. So the kinds of issues that I see coming up with small businesses are the requirements for employee safety. What are we required to do? I went into a gas station. I'm not going to say which one, but I went into a gas station last week. No one was wearing masks, right? Not even the cashier. And so I asked, what's going on? Well, the city changed it so we don't have to. So nobody was wearing masks. So is that a requirement? Depending on your industry, not necessarily, but is it a good idea to have your cashier interacting with the public without any form of PPE or even a plexiglass? Not necessarily. So you're taking a risk if you haven't thought through your employee safety first and foremost, and especially if they're interacting with the public. And so what we're going to do next week is we're going to put on a special safety session called Accelerate Your Reopening with a Safety Plan. And we're going to talk about those kinds of details. How do you determine what kind of PPE might be required in your industry? And even if it's not required, is it still a pretty good idea? I think I may be answering that question and leading this a little bit, but employee safety, ensuring what are the liabilities if you don't. So super important. Customer safety, Judge Wolf said no shoes, no shirts, no service, right? Well, how does that actually work in real life? Because do customers get mad when they're told they have to wear a mask or leave? Yeah, they kind of do. So how do you manage that? How do you manage to try and keep your customers safe and maintain that, not just the compliance in terms of the state reopening, but what do you look at as best practices, and what could be the consequences if you don't look at best practices, you just do bare minimum of what's required? So that leads into the next thing that we're going to talk about, and that's regulatory compliance. We're going to take a look at what state and federal agencies are requiring, and specifically OSHA, in terms of how do you protect your employees. So what do y'all think? If you require PPE of your employees, do you have to pay for it or not as a business? Yes, OSHA does require you to pay for PPE that you're requiring of your employees. So it's very tempting as a small business. I'm a small business owner, right? So it's very tempting to say, okay, well, if I don't have to give my employees a mask, if the federal government's not arm twisting me into it, then I'm going to skip that step for my employees and I'm going to skip the expense. You may want to rethink that. And so that's what we're going to talk about next week is how do you reopen in a way that's going to keep everyone safe and not just do the bare minimum, but also we're going to talk about what the requirements are and the regulations, but we're going to talk about managing it from a big picture and how do you reopen safely. I don't know if y'all are seeing your friends on Facebook taking pictures of themselves out and about, like maybe going to a restaurant. And what are they doing? they're taking pictures, right? And they're reporting back to their peeps what that company is doing to keep them safe. And they're very specific. They're wiping down tables. They're wearing masks. Servers are wearing masks. So the word is getting out on the streets, maybe that the businesses that are doing a good job of reopening safely, as opposed to either breaking the rules completely or just doing bare minimum. And those are the kinds of things that can impact whether or not you're going to get return business and who's going to want to frequent your business. So anyways, I'll turn it over and just say that those are the big ticket items that we're going to talk about next week.
No, thank you very much. We look forward to, I'm sure the attendees also look forward as well. Councilwoman Gonzalez, we still have a few minutes, but I know you got cut off. Are you back on again?
Yeah, so I got to hear the end of that conversation. And I do think it's important to note that the city in particular has dedicated about $40 million towards small businesses and stuff like PPE and protective wear and sanitizer. Jennifer mentioned that she participated in the program that the city sponsored, but that continues, it's ongoing. And programs that the city will fund for small businesses, whether it's to help pay rent, whether it's to help pay employees, utilities are eligible expenses to keep many of those small businesses open. And we know that the majority of people, 97% of all people, are employed in small businesses. And so I feel like by prioritizing small businesses, we're finally getting the attention that we deserve as small businesses for keeping the economy afloat, for being flexible, and for trying, of course, to keep our employees and our customers safe as they, continue to go about their business. So we are especially grateful for all of our employees and of course for the customers that keep us open. And so I know I'm a small business owner as well. My family has owned a pawn shop here in San Antonio for 60 years. In fact, this year we're celebrating our 60th anniversary. And, just like everybody else, we have been very cautious and also very fearful. We've been an essential business, so we've been open every day since this started, and grateful for the ability to stay open. At the same time, living with a lot of fear because it is my family here. And of course, all my employees are considered family, but we are have been very careful with each other and sensitive with each other, allowing people to take time off. Dr. Taylor mentioned the paid sick leave that we know is important as well. And, that was an issue that we took on here in the city. The majority of the council members wanting to support some type of paid sick leave. That was before all this COVID started. So we know that that's a really important piece as well, is that people can take off. So some of these payroll protection programs were designed for that, to pass on to the employees so that they could take time off if they were sick or if they needed to take care of family members. So I really do believe that the city is taking the right steps. I don't know if you heard me talk about the dashboard before I accidentally ended the call, but I think the one that Dr. Taylor and the team presented in their presentation showed how important, first of all, opening businesses are. All of our businesses are essential as far as we're concerned. And so it's a dashboard that shows what is considered high risk, medium risk, and low risk. So hopefully people can see that and participate in our economy as much as possible, buy local, and also just look to our city, sanantonio.gov, and in the small business area for all that we're doing for businesses.
Perfect. That's great. And so again, thank you to all of you for participating with us today. And so I've been reminded myself to remind everybody that we have safety materials, information about safety materials on our website. And we'll soon, have the Back to Business Handbook available, which is a resource guide that we have developed within the UTSA Small Business Development Center COVID Business Recovery Accelerator that will provide in-depth information on bringing, rehiring employees, bringing employees back safely into the workplace. This is something that we'll be making available to all those who attended today. We'll send it out and provide it along with the presentation. We have recorded this particular event today, which will be up on our website, so that if any of you missed anything, you're more than welcome to obviously review it and replay it. Thank you to all of our panelists today, Commissioner Calvert, Councilman Gonzalez, Dr. Taylor, CJ, and of course our client, Jennifer. Thank you for participating, and we're very happy you were able to participate in that essential items bag of the PPE and things that you need to reopen your business safely. So thank you. And our upcoming training on the 18th, more of what CJ had to discuss today. And our next town hall will be on June 23rd, which will be obviously a Tuesday. We will be announcing workforce development. So we'll be inviting the local community workforce development organizations in about helping employers on rehiring, providing employers resources on how to provide professional development opportunities for them, as well as for those, those in workforce in the community that are no longer working right now, that were affected by COVID-19, how to get back into the workplace and possibly reinventing yourself. So again, my name is Jaime Martinez. Thank you for joining us at this particular town hall. We look for you to see it again. If there are questions that you did not get answered today, you have questions about your small business or any of the financing available for you, all the disaster loans, here's our contact information. Please feel free to contact us and reach out. We'd be glad to help you out. There's plenty of people to be able to answer all of your questions. So again, thank you to all of our panelists, and everybody had a good rest of your week. Thank you.
Thank you. Bye.
Thank
Bye.
you.
Thanks, everyone.
Thank you.
Thank you. Have a good rest of your day.
Thank you.